Michelle asked us if we would give a little presentation on a spreadsheet that I came up with early on in my COPD
Mm-hmm.
career. Um, Basically, I think the title we used here was How to Keep Track of Stuff, and the subtitle would be How to Impress the Heck Out of Your Doctor, because I guarantee this will. Um, However, since we started doing this the first time today, Michelle and various and sundry others have come up with little apps that do a lot of what I have been doing myself with
Great.
very rudimentary equipment, a stick and a rock mostly, for years. So at any rate,
Tedious.
bear with us. Tedious it is, yes.
Tedious.
Early on, when I started my career with the medical profession, I noticed that number one, doctors have about 15 minutes
Mm-hmm.
to spend with you, and before you even get to see the doctor, the nurse takes your vital signs, your blood pressure, your temperature, your pulse ox, your weight, this type of
Mm-hmm.
thing. And if you're lucky, if you find somebody who knows what they're doing, maybe even a lung function test. Trouble is that the vital signs that they take in the office that day and record is simply a snapshot of where you are that particular day. If it's been 3 months or 6 months since you've seen that particular doctor, what they're looking at are two snapshots, one 3 months or 6 months ago and one today. So I decided, being the accountant brain that I am, and having access to an Excel spreadsheet back in those days, I developed my own little Excel spreadsheet, which Joe will show you here in a couple of minutes once I describe it. But keeping track of my vitals on a daily basis. And this did a couple things. It endeared me to several doctors and several nurses and a couple transplant coordinators, and it gave me a lot of information as far as how I was doing, if there was a trend
Mm-hmm.
happening. COPD, as we all know, is a disease that comes on you very, very gradually, and to the point that you don't really notice any changes on a day-to-day or even a month-to-month basis most of the time.
Yeah. So you were kind of looking for a trend that either became a positive trend,
Mm-hmm.
hopefully, or a negative trend.
Exactly, and the negative trends would many times wind up as an
Mm-hmm.
exacerbation, which would drive you to the doctor or the hospital or the ER or whatever it might be, at which point they would take another
Mm-hmm.
snapshot. So
Yeah.
I started off with the date, the ARPM, and I did this on a daily basis. My weight that
I've got to
particular
go there.
day, my
Yeah. Be right back.
okay, my temperature, uh, magic little thermometer thingy that will tell me that my temperature is 25.6. I have no idea what that means. Um, a little blood pressure cuff. A lot of doctors' offices are using these now. Um, and it gives you the blood pressure and your heart rate. Looks like our dog ran off with something.
Mm-hmm. And you're as crooked as
My
it.
picture. Oh,
On the wall.
the owl. Blame Bonnie. Um, okay, pulse ox is 96. Heart rate is 70. And this is what I was so proud of until Michelle showed me what she has. This is my little spirometer. And it will give you a FEV1 in liters, which I then converted to a percentage, and my peak flow. So peak flow is 547, 3.36. That's not too good. It was better than that earlier. At any rate, I normally will blow about 115 to 120%, but that's with 40-year-old lungs. So my lungs are exactly half as old as I am at this point.
And I wanted to add that I think it's really important for your caregiver, your person, to also know these facts and what this kind of a spreadsheet's going to tell the doctor, because it also will tell the caregiver
Mm-hmm.
if something's going awry.
Exactly.
You need to know what is going on, both patient and caregivers.
Right. Because there are times, unfortunately, when a patient is not in good enough shape to really
Mm-hmm.
analyze what is going on.
Yeah.
They may be going down into an exacerbation that would kind of take them out of the picture as far as analyzing this. So that
It's I think it's just really important. The more, and we've talked about this so much, the more knowledge we all have,
oh yeah,
then the more powerful we can make our decisions.
absolutely. And the more knowledge we have about what is wrong with us, whether it's COPD or
Something else.
bizarre comorbidity,
Yeah.
whatever that particular doctor may be, they're not going to have to spend half of your 15 minutes reinventing the wheel. Now, as we discussed earlier today, there are certain people, and I know none of them are on this call, but certain people that don't really want to know what's going on, because you go to the doctor, they say, "How you been?" They say, "I'm great." Well, if you tell them the truth, they might put you on oxygen, or they might give you another inhaler, or they might give you something else unpleasant that's going to have nasty
Like you
side
need
effects.
to exercise way more. What do you
Yeah,
think?
horrible things.
Yeah. Well, I've been a hospice volunteer for 22 years now, and I know that in trying to talk with doctors, you've got a very short amount of time because they are incredibly busy.
You bet.
So I just want to encourage everybody out there to learn everything you can learn about your disease and to know the person that you're working with well. That's your own person,
That's right.
because then you would be able to formulate questions to ask the doctor and then be able to understand his answer without having to, what?
And I have gotten more out of medical personnel over the years by simply being nice, asking them how they are. How's the family? How's the whatever? Don't take up a lot of time, but be pleasant.
Yeah.
A lot of people aren't. A lot of people are upset. A lot of people are scared. A lot of people are, again, simply don't want to know. So one of my watchwords is never piss off anyone who's in a position to harm you. And that would include doctors and nurses and transplant coordinators. So.
Well, I think it's also important to go along with this kind of chart, and it doesn't obviously need to be done the way Jim did, because modern medicine is coming up with applications that really work.
Absolutely.
But one of the other
Show
things.
Show them the chart, Joe, if you will.
Okay.
Joe? Show them
One
the
of
chart?
well, while he gives it up, one of the other things I wanted to say was it's really important to have an up-to-date med schedule.
There we go.
And Jim carries one for himself and me in his billfold, and I carry one for he and I in mine, just in case.
Being a double lung transplant recipient, cancer patient, a couple, 3 times over. Oh my God, I came up a while back with, I think, either 13 or 15 different comorbidities. I've got a med list that I need 2 people to help me carry.
Okay, here's the chart.
Here's the chart. We have date, time, weight, blood pressure, temperature, SpO2, pulse, peak flow, FEV1, FEV1 percentage. Initially, we had, right after I came out of the transplant, we also had bowel movements, which were of interest to somebody apparently. And a lung transplant will many times throw you into a diabetic situation for a while. So we're keeping track of that.
Yeah.
So
And exercise, did you mention that?
I have,
The amount? Yeah.
exercise we have, and attitude, comments, how I was feeling that particular day, because that's part of the trends also.
I think the attitude part was truly important because if people start feeling not as well as they have been, their attitude goes downhill.
Mm-hmm.
So that was something we could easily watch to show a trend.
You bet.
And then I could turn around and show it to Jim and say,
Mm-hmm.
well, yeah, this started a few days ago, and we need to see what it is.
The type of thing Mary keeps track of.
Yes, Mary keeps track
Yes,
of those
indeed.
things.
So, okay, we are back. So that's my chart. I still keep it. I've got a bunch of years at this point stacked up. I look back on some of it now, and the first one I looked at when I was trying to find this was the first one I had out of the hospital after my transplant. And the second day out of the hospital, I did 5 minutes on an exercise bike, which I was very proud of.
But I think it took you 3 times.
It did.
I mean, that,
It did.
and that's important for everybody to realize
That's exactly
too.
right.
Exercise is crucial. And if you can't do all of it the first time, come back and do it the second time,
absolutely.
the third time.
You
Just
bet.
need to get that amount of exercise in. It makes all the difference. We earlier heard from Andy in the UK talking about it took him about 8 months of exercise to be able to work up to do the 32
something like that.
mile, and he did it. And now he's working to do that kind of thing again.
Mm-hmm.
It can increase the quality of your life more than you can ever imagine.
Absolutely.
Way more.
Is that our buddy Andy Barker?
That is, I
That is.
believe.
Indeed.
Good for him.
Yeah.
Andy was heavily into the, as he put it, Nelson's blood, which he calls his brandy today. I was very jealous.
Oh,
He
But
was
to bring-
just
to bring
starting.
back
He
our
was
point-
just starting.
Yes, he was.
He was. You're right.
I'm going to start referring to him as Andy Nelson.
that would work.
But what all this charting also brings me to something I want to say. And this was the first time I ever heard it. We were at a conference in San Diego with Vernon Farrell, and one of the doctors started talking about the importance of an action plan, that he was a pulmonologist and he wanted all of his patients to have an action plan of what they needed to do if things changed. And I believe his name was Dr. Teague,
Mm-hmm.
and he even said, if you start an exacerbation, I want the first invitation. This is the party I want to be at before anybody else,
That's right.
which I think is probably a little unusual, but he meant it. So if any of you have not gotten an action plan put together with your doctor and or doctors, I would urge you to do that. It's like we have said so many times, there are so many comorbidities that go along with this. Make sure all of your doctors know what is in place.
You bet.
Know if a temperature goes up, at what point do you need to find out what's going on, or do you need to call your doctor, or do you need to call an ambulance? There are so many things that you need to have an understanding of, and the caregiver should have that same understanding of it
Absolutely.
all possible.
Absolutely, if not more so.
Yeah.
This is a miniature polar bear that we adopted.
Hi, Pooh. Yeah. That's our new puppy, who has kept us very busy, and it's perfect for this time of being housebound like most of us are.
Me and you and a dog named Boo.
Yeah. But that's a lot of what we're trying to get across, and we do realize here we are preaching to the choir, but it's easy to forget some of the smaller details of what we all really need to be doing and then really need to be sharing with the other people in our lives, if you can do something that will help you feel better longer, keep you healthier
You bet.
longer,
Absolutely.
that's what we all need to be concentrating on. The one thing that I have preached for a long time is attitude. It's like Jim said about smiles. Remember to thank the people that are taking care of you, or
you
to say
bet.
please.
You bet.
Gratitude can go a long ways. And the last thing I need to talk about is never ask a lung patient to hurry.
That's right.
It's an
Absolutely right.
impossibility. They will try, and then they will start getting more short of breath, and then the anxiety will set in, and then more short of breath, and maybe the anger, and then
Disaster.
they can't do anything because they've worn themselves out. So Scott Soretta kept saying to me, Mary, what's your watchword? And I would say, never ask any patient to hurry.